Menopause is defined as the time when there has been no menstrual period for 1 year. We can only retrospectively determine that this has been the last menstruation. The whole period of the menopause lasts at least 10 to 15 years and is not simply defined as the last menstruation. The menopause is determined by dropping estrogen and progesterone levels, and in the later years, around 60, also androgens, the male hormones of the women, as well as by the absence of the corpus luteum.
The
premenopause is characterized by the change of the female cycle. Before this change, the menstrual bleeding generally occurs monthly and lasts 3 to 5 days. During the premenopause, the intervals suddenly change. The cycles can be shorter or longer and last from 2 to 6 weeks. Also, the amount of menstrual bleedings often changes. It is important to know that the menstrual bleedings can be very strong. They can last 8 to 10 days, and sometimes they are even accompanied by anemia. The postmenopause is characterized by the permanent end of menstruations. The menopause is the last menstrual bleeding. The postmenopause begins 1 year after the last menstrual bleeding. In this case, other symptoms start to appear. These symptoms are caused by estrogen deficiency. At the beginning, there are still slight estrogen fluctuations, but then the estrogen production slowly draws to a close. First symptoms of estrogen change are hot flushes, insomnia, sometimes tachycardia, and some women might also have joint problems. Low estrogens or slow decrease of estrogen production can lead to vaginal dryness. Sometimes it can also cause pain during sexual intercourse, bladder discomfort, and more frequently bladder infections. The treatment of the menopausal symptoms can be divided into 2 levels. The first level is the phytotherapeutic level, which means the level of herbal medicine with Simicifunga racemosa, which is the plant called black cohosh. And then there is the conventional medical level based on the hormone therapy with estrogen and gestogens. Basically, all women can be affected by these symptoms. We know that the menopause mostly occurs around the age between 52 and 53. The hormonal changes are ultimately the same for all women. We do not know exactly why some women perceive them very strongly and why other women feel very little physical discomfort. It is very important to contact a qualified specialist. The woman should explain the symptoms. Thereafter, the expert, either a gynecologist, a pharmacist, or an expert from the drugstore, can provide the necessary assistance.
Auch in der Apotheke als auch in einer Drogerie können die Fachpersonen Hilfe leisten.
For women, it is very important to take every wish seriously, to deal with it, and to be involved in the decision process. What do I want? Where do I want to go? What does this mean to me? It is crucial to take the whole matter seriously and to confront it.